the one that I'll mention that's become maybe a little bit more interesting to people in recent years has been vitamin A. There's actually been a lot of people studying vitamin A deficiency, particularly with gastric bypass these days. I don't think I know anybody at this point in time studying it with sleeve gastrectomy. But there have been some reports of it, and the most recent study up here was Casey Allison's study. She's out of Detroit. She did a study looking at a large group, a retrospective study looking at a large group of her studies, and found that they actually had about 18% of their patients showing up with at least a mild degree of vitamin A deficiency. So they looked into that a little bit further, and they found, so I said I would talk about protein and maybe some low-grade representations of protein deficiency early on. They found that this was more of a chronic thing that was showing up in patients 3, 4, 5 years after surgery in patients who had slightly depressed protein. So they didn't have protein that was so low that they had protein malnutrition where they were very sick that way, but protein does a bunch of stuff, right? We build muscle with it, it's part of our immune function, we do tissue repair with it, but one of the other things it does is it carries vitamin A around your body, okay? So it carries some other things around your body. And if you're not taking in enough on kind of a chronic basis, protein will do its most important jobs and kind of get lazy with its less important jobs. So apparently carrying vitamin A around is a less important job than keeping your muscle healthy and doing tissue repair, which is probably good overall, but it's not good long term. So actually what they found in these patients is they really didn't have what I would call real vitamin A deficiency. They had not enough protein to get the vitamin A moving around in their bloodstream so that when their doctors drew their blood, they couldn't see it. Does that make sense to people? And once they got their protein levels back up, once they got them taking in more protein, suddenly that vitamin A sort of reappears because they're now carrying it around in their body.